So as we're getting closer and closer to vaccine approval in the United States, which could come as soon as Thursday or Friday of this week or over the weekend, there are more and more explosive disagreements about what needs to be done right now in terms of the virus. And there was a conversation about this that completely exploded on CNBC a few days ago. Now, for context, if you've been following the absolutely horrifying numbers, cases in the United States have gone off the charts. We've had as many as 200,000 cases per day recently. And it's not just cases that have been increasing. Deaths have also exploded. And now looking like we could have really a sustained period of 3,000 deaths per day for some time. That's essentially a 9/11's worth of deaths every single day. Now, assuming the vaccine is shortly approved, it's going to be a relatively slow rollout. If you look optimistically, we would have the capacity to vaccinate maybe 6 to 8% of the population per month, maybe more if we get a second vaccine, maybe even a third vaccine approved and starting to be supplied. So the point is, no matter what, the next 3 months are going to be a time where we have to be really, really careful. So on CNBC, anchor Andrew Ross Sorkin, who has mostly been in favor of just following what experts say. It's not he's coming up with this stuff. He's mostly been saying, here's what the medical experts are saying. He was on an interview panel with correspondent Rick Santelli, and Rick Santelli has been wildly out of control, loudly and defiantly ridiculing and ignoring varieties of guidelines. And the situation escalated really quickly. Let's take a look.
Yes, no, believe me, I believe in careful. And when I point out governors cheating, it's not for the hypocrisy which exists. It's the fact that I think many of these governors are intelligent people and they love their families, which they've taken out into restaurants. Therefore, there is actually and should be an ongoing debate as to, why a parking lot for a big box store like by my house is jam-packed. Not one parking spot open. Why are those people any safer than a restaurant with plexiglass? I just don't get it. And I think there's a million of these questions that could be asked. And I think it's really sad that when we look at the service sector and all the discussions we've had about job losses, that particular dynamic isn't studied more, isn't worked more. We don't put more people in a room and try to figure out ways so that these service sector employees and employers could all come back in a safer way. You can't tell me that shutting down, which is the easiest answer, is necessarily the only answer.
So now here so far, although Rick and I would come to different conclusions, I don't disagree with Rick about what he's saying. There are many guidelines, particularly when you look between states, but also within states, that aren't coherent. He says, why is it safe to jam pack a big box store, but a small restaurant can't be open? That's a great question. And in fact, it doesn't appear to be safe to jam pack the big box store. In many states where people aren't wearing masks, especially, big box stores are exactly where a lot of the contagion is happening. Rick is inadvertently getting to an important point, which is it's not that open all restaurants. It's the big box stores aren't actually safe. Back in early November, officials in El Paso, Texas found a huge number of cases were being transmitted at big box stores in El Paso, including Walmart, Target, Home Depot, and Lowe's. So the problem is Rick saying open everything because the big box stores are open. It seems really what we need is the big box stores need to dramatically reduce capacity. So then Andrew Ross Sorkin jumps in and this gets ugly pretty quickly.
Rick, I just as a public health and public service announcement for the audience, the difference between a big box retailer.
Who is this?
Hold on. The difference between it's Andrew.
Who else?
The difference between a big box retailer. Hold on. The difference between a big box retailer and a restaurant, or frankly, even a church, are so different. It's unbelievable. Going into a big box retailer,
I disagree.
You're wearing a mask.
You can have your thoughts, and I can have mine.
You're required to wear a mask.
I disagree.
It's science. I'm sorry. It's science. If you're wearing a mask,
science.
It's a different story.
500 people at a Lowe's aren't any safer than 150 people in a restaurant that holds 600. I don't believe it. Sorry. Don't believe it. And I live in an area where there's a lot of restaurants that have fought back and they don't have any problems. And they're open.
Okay. You don't have to believe it, but let me just say this. You're doing a disservice to the viewer because the viewers need to understand it.
You are doing a disservice to the viewer. You are. You are.
I'm sorry. I'm sorry. If I would like to keep our viewers as healthy as humanly possible. The idea of packing people into restaurants.
I think our viewers are smart enough to make part of those decisions on their own.
So it quickly became, no, you are, but what am I? And now Rick actually says something interesting. Our viewers are smart enough to decide on their own. That is just not true. I hate it that it's not true. Check out my video, viral video from, what was it, a year or so ago? We have to accept that a lot of people are stupid. Have you seen the Trump rallies where rally goers are asked, why aren't you wearing a mask? And the answers range from the virus doesn't exist, it's a fake news conspiracy, masks do nothing, I'm protected by Jesus because I prayed. The problem is you need the guidelines to be stricter than what most people would need, because there's people that will disregard them completely. You say outdoor is fine without masks, as was said earlier in the pandemic. Then you see hundreds of people packing narrow hiking trails in California. They've found the one way to make outdoor not safe. So now you need to say, well, you need masks outdoors as well. You got to close the hiking trails. People aren't smart enough. That's an unfortunate thing. Let's see the last bit of this.
I don't think that I'm much smarter than all the viewers like some people do.
Can I get in here, please, and get back to the jobs report?
How's that working out for you, Rick? How's it all working out for you? I mean, look at the numbers, Rick.
It's working out fine.
I think the numbers, Rick, belie. Rick, the numbers show that the idea of let it rip has not worked all that well.
And people are getting sick and dying.
I understand
all that well,
it.
Rick. I just think the way we deal with it isn't necessarily optimal. I think if we spent the rest of the show talking about this.
So, of course, the way we've dealt with this hasn't been optimal. That's absolutely true. No coordinated federal response going back 10 months now. Disinformation coming out of the White House, a vector of disinformation, replacing, we could pick anything, replacing Dr. Anthony Fauci with a radiologist for months, as Donald Trump did. Suggesting maybe you inject bleach and hit the body with a disinfectant. But part of the reason we need to be fighting uphill is because of people like Rick Santelli. So I think that, listen, I've said before, you look at states with high and low mask usage, at least on paper, and sometimes you don't see dramatic differences in contagion. What explains that? Well, you've got to dig deeper. Maybe the state with the high mask usage on paper, people are having more indoor gatherings because it's a cold state. And so you don't have people abiding by only hanging out outdoors. I get that there are still many questions we don't understand. You look at Latin American countries, on paper, some of the strictest guidelines and even actual lockdowns. And they have some incredible rates of contagion. Well, when you dig into it, you realize on paper, the guidelines are strict. Nobody's abiding by them. I get it. But we can't pretend that the problem is merely that all of the scientists are wrong and have no idea what's going on. It's absolutely ridiculous. And that escalated very, very quickly.